Thank you, and a very good afternoon. And I must start by congratulating the organizers for such a great event and a conference that has been put together. And when I was asked to participate in this conference by Preetha, by Shobna, Dr. Reddy, I readily agreed because this is one area where, as an institution to which I belong, the Confederation of Indian Industry, and myself personally have been involved for over a decade in really seeing how we can further the cause of some of you who are present in this hall and taking that further. So it's really a great pleasure coming here and talking to you about a specific subject which has been given to me today on public-private and people partnership and setting the context. And I think much of it has already been spoken. So I'll hazard to go really a little beyond at times and then come to the specific subject of PPPs. The conference is really indeed, as I said, a unique initiative which has brought together in one platform a collective group of such eminent stakeholders to discuss about the future of the country. When I was told about this initiative and its proposed contours, I felt that this was a very unique format, and I was very sure that this process will be able to throw up some very concrete suggestions and outcomes. These discussions are even more appropriate, as I believe, in the current context when sustainability of healthcare systems across the globe is now threatened by barriers such as the rise in healthcare spending, mushrooming population, and of course the transition towards non-communicable diseases. Just to focus on some of the key challenges that we have on the healthcare delivery side, at the turn of the century, health outcomes in India and the quality of underlying health systems significantly lagged those of the other developed nations. From such a very weak starting, if one can say so, the progress made in the last decade has been mixed, and in fact, in certain cases, and I must compliment the private sector here, has brought in tremendous amount of, has played a tremendous role in the sector. During this last decade, one has seen an important role which has been played by the private sector in improving health access and quality of services across. The government, of course, has also recognized the importance adequately, as we see in the 11th and the 12th five-year plans. Yet today, we find in India, it's lagging itself behind in comparison to its peers on healthcare outcomes. The key challenges that we see in front of us could be shifting the balance between the private out-of-pocket spending and public expenditure on healthcare, and a much larger percentage of the population to be covered under the health insurance. Huge investments required in infrastructure development, making healthcare facilities much more accessible to the rural population, bridging the shortfall in medical talent and skills. Adding to the continuing challenges is the upcoming burden of the non-communicable diseases, which would enhance manifold the challenges for healthcare providers, both government and the industry. So, PPPs in healthcare, where can it work? Coming to that topic, all along, we at the Confederation of Indian Industry, at CII, we have been conscious that while the provision of the health will continue to remain a responsibility of the government, private capital and expertise can play a large role in inducing efficiency and innovation. Therefore, catalyzing a regime for PPPs in the health delivery and public health has been continuous to one of our major thrust areas within the organization, and as we have been talking both to the private and the public sectors. We believe that in the near and in the medium term, there are 6 major thrust areas where public-private partnerships can be evolved as synergistic models to combine both social objectives of universal healthcare access and the business objectives of running a profitable healthcare facility. In each of these areas, there will be different capabilities and drivers for public and private sectors in a PPP arrangement. And these areas, the thrust areas, are, of course, 1, infrastructure development; 2nd, the management and operations; the 3rd, capacity building and training; 4th, financing mechanisms; 5th, IT infrastructure; and 6th, material management. So while governments, especially state governments, are increasingly looking forward towards a public-private partnership models to solve larger problems in healthcare delivery and wellness, unfortunately, unlike other verticals where PPPs have registered greater successes, it has not been possible to replicate the same in the healthcare, while PPPs have really not functioned the way it should have, but there is no alternative but to see to it that PPPs are made a success. Scaling up of individual PPP successes on a nationwide level continues to remain a very major challenge. The guiding principles of a robust healthcare PPP model will have to be effectiveness or ability to meet program objectives, efficiency or financial efficiency in a transfer of ownership and associated risks, equity or ability to accrue the benefits of the program to the poor people, and financial sustainability or financial viability of the model. Effective PPPs can actually challenge the notion that private healthcare is for the rich and public healthcare is for the poor. So in alignment of these basic operating principles of a PPP model, we from the industry, from CII, we had prepared and submitted a PPP model to the Planning Commission, which provided the necessary details of a viable 200-bedded hospital utilizing the existing district hospital in a tier 2 city of India, whilst clearly defining the role and commitments of the private sector. In another unique PPP initiative, we set up the Healthcare Sector Skill Council in partnership with the National Skill Development Corporation, and I must say that over the last 1 year, this has taken off very effectively. Excuse me. CII also has driven a major PPP initiative in the public health arena. These initiatives, starting from communicable diseases like AIDS, TB, and malaria, are now evolving into focused initiatives of addressing the challenges of the NCDs. Recently, a massive screening drive for diabetes was carried out by CII in Mumbai under the leadership of Shobna in a collaboration with the Brihan Mumbai Municipal Corporation, under which the BMCG and the CII members across the city came to carry out testing. Thank you. We had conducted this between the Brihan Mumbai Municipal Corporation and the CII membership, and across the city this was carried out, and we came out with touching approximately 1.5 lakh Mumbaikars in just one day. Therefore, what we say that the 12th five-year plan has indicated the need for a strong public-private partnership as an effective mechanism in improving the healthcare access. PPPs are now redefining their structure and evolving towards a wider paradigm to also include people participation and community engagement as an effective mechanism in improving the healthcare access. However, the development of robust models in this area has multiple challenges and constraints. Going ahead, we feel the government will need to establish a national PPP framework that enables local health systems to tailor solutions and demonstrate political will. The private sector should relook at how it can share risks and accept fair margins. In addition, private players also need to understand the social obligations under healthcare PPPs and ensure strong long-term partnerships. As we look into the future of PPPs in India, we feel to make this sustainable and robust, a few major interventions will be required. And I just would like to mention some of these to you. Number one is the creation of a legal framework for PPPs. Number two, carefully choosing and testing PPP models for understanding the key value drivers and risks. The third, actively building a market and supplier base for public-private contracts. And finally, implementing strict controlling and performance monitoring. I hope that this session would therefore be able to, with its strong panel that it has, discuss threadbare some of the challenges related to these issues and come out with a few concrete suggestions which can lay the path for deeper analysis and action in the near future. I'm also happy to mention that PwC and we have prepared a special report on the subject along with successful case studies from various countries and India. These recommendations from this session and along with this will be added to the white paper before submission to the Honorable President of India tomorrow. With that, ladies and gentlemen, thank you very much for your listening. Thank you.